Hello, my name is Dr. Sumara Rashid, and I am the Program Director of the Dental Assisting Program at Northern Virginia Community College at the Medical Education Campus. Today, we will be going over the program information and policies of the Dental Assisting Program. The Program Information and Policies Manual is divided into 3 sections. Section 1 deals with goals, information, and policies. Section 2 deals with bloodborne infectious disease policy, infection control policy, hazard communication program, management of emergencies, ionizing radiation policy, patient selection for exposing radiographs, guidelines for administering nitrous oxide and oxygen sedation. Section 3 deals with the guidelines for exposing radiographs. In this session, we will be discussing Section 1 of the Program Information and Policies Handbook. Northern Virginia Community College has a mission. With commitment to the values of access, opportunity, student success, and excellence, the mission of NVCC is to deliver world-class in-person and online post-secondary teaching, learning, and workforce development to ensure our region and the Commonwealth of Virginia have an education population and globally competitive workforce. And the vision of the college is to be a learning-centered organization that promotes student success. There are numerous general education goals that the college has in mind that are listed on the first page of the handbook. They deal with the students will demonstrate college level communication skills, enhance lifelong learning skills, critical thinking and problem solving skills, developing an understanding of interpersonal and human relations, quantitative skills and computer proficiency, understanding of culture and society, knowledge of science and technology, and developing the knowledge of wellness necessary for a healthy lifestyle. The American Dental Assistants Association has a mission statement as well, and it is to advance the careers of dental assistants and to promote the dental assisting profession in matters of education, legislation, credentialing, and professional activities which enhance the delivery of quality dental health care to the public. The dental assisting program here at the Medical Education Campus has 5 main goals. The first one is to prepare students to have the knowledge and skills required to perform chairside assisting duties, expanded functions, dental practice management procedures, laboratory procedures, as well as exposing diagnostic radiographs. The second goal that we have for students is, of course, to pass the DANBE exam, which is the Dental Assisting National Board Exam, and to provide students with the knowledge and skills to obtain employment as dental assistants, and to provide students with the knowledge and skills to pass and complete courses in the dental assisting program. And last but not least, to provide students with the knowledge and skills to complete the dental assisting program and graduate. The dental assisting program has student learning outcomes and competencies that are listed on page 1 of your handbook. The dental assisting program is an accredited program, and it maintains the status of the accreditation from the American Dental Association's Commission on Dental Accreditation. This is a specialized accrediting body recognized by the United States Department of Education and by the Council on Post-Secondary Accreditation. Their contact information is listed on page 2 of your handbook, as well as their address. The dental assisting program undergoes accreditation every 7 years. And in those 7 years, the students that have any concerns or complaints that are related to the accreditation standards for the program are collected and reviewed in order to enhance the program's quality. Their statement can also be reviewed on page 2 of the handbook. In the dental assisting program, students are required to attend all classroom, lab, and clinical sessions. Students who are going to be late or absent are to contact their course instructor, and any student that is absent more than 20% of the scheduled classroom lectures, labs, and clinics are not to expect to receive a passing grade. Students who are absent from class due to illness must present a course instructor a note within 48 hours of returning to class to have an excused absence. All students are expected to conduct themselves professionally, and that includes not having any disruptive behavior, such as excessive talking, excessive studying when not supposed to be doing that, consumption of food, beverages, chewing of gum, or doing other classwork. Students are expected to turn off their cell phones, and any type of disruptive behavior and use of devices are disruptive to the learning environment as well as to your colleagues. And then students who engage in that type of behavior will be asked to leave. Cheating and plagiarism are considered serious offenses, so those students who are found engaging in cheating and plagiarism will be subjected to disciplinary action. Students are expected to submit all their assignments and course projects on time. Information on the topic is found on each respective syllabi of each respective course. Please review the syllabi of each course in order to further determine the details of absenteeism and any policies that deal with any missing coursework. Examination, quizzes, and tests are expected to be completed by all students, and students who miss them because of absenteeism will have the responsibility to contact the respective course instructor to make up such work if allowed. And of course, any type of makeup examination and its format is at the discretion of the course instructor. Remember, examination, quiz, and test dates are firm, but the content may vary from that in the syllabus if all the goals of a particular section are not complete. Additional information can be found in each respective course syllabi. With the performance criteria, all students must successfully complete the didactic, lab, and clinical courses with a 75% average or higher in each course to continue on to the next semester. The didactic courses consist of DNA 100, which is Introduction to Oral Health Professions, DNA 108, Dental Science and Laboratory Session, DNA 110, which is Dental Materials and Laboratory Session, DNA 113, which is Chairside Assisting 1 and Laboratory Session. DNA 114 is Chairside Assisting 2 and its lab. DNA 119 is Dental Therapeutics like Pharmacology. DNA 120 is Community Health. 130 is Dental Office Management, and 134 is Dental Radiology and Practicum. Clinical courses are different. They're DNA 140 and 190, which is the Externship and Seminar, and the Coordinated Internship and Seminar, respectively. The grade scale, please take note of that. That is found at page 4 of your handbook. And please note that a grade of A would be from 92 to 100 and not 90 to 100. For a letter grade of B would be 84 to 91. For C would be 75 to 83. Anything above a 75 is passing. However, for the course called DNA 190, which is the Coordinated Internship and Seminar, anything above an 80 will be passing. Please note that having a 75 in the course of DNA 190 is not considered passing. Failure to maintain a 75% average in all the dental assisting courses will necessitate a student being dropped from the program. Students who are having academic problems are encouraged to contact their instructor. So communication is always key in the dental assisting program. Anybody that falls below a 75 mid-semester will have to Anybody who falls below a 75 at mid-semester are to meet with their instructor to discuss their status and ways to improve their academic performance. In addition, students are to make an appointment at least once a semester with their advisor to review their transcripts as well as their academic progress in the dental assisting courses. You can feel free to review all this information on page 4 of your handbook. Class withdrawal information. Students are having academic problems are to contact their instructor as soon as possible to make an appointment for remediation and assistance. Students are always reminded that this is a professional program and each semester is a prerequisite for the next. So therefore, all courses must be passed in order to go on to the next semester. The policy in repeating courses and readmission to the program. Each course in the dental assisting program must be completed with a grade of C or better before taking the next course in the sequence, as well as to satisfy graduation requirements. All courses in the dental assisting program must be taken in the sequence as outlined in the college catalog. And then, of course, all courses must be passed with a grade C or better to receive credit and to graduate. Any student who has voluntarily withdrawn from or who has been withdrawn due to unsatisfactory academic or clinical performance can apply for readmission following the current admissions process, providing they have not failed a course prefixed with DNA. However, do remember that readmission is not guaranteed. Any student who has been out of the dental assisting program for any reason longer than 1 academic year must reapply under the current admissions requirements. And if accepted, the student will be required to repeat all the DNA courses. Students who have received a grade of F in 1 or more of the courses are not eligible to reapply to the program. Feel free to review the essential functions that are expected of the dental assisting program at the top of page 6. Students are required to have physical evaluations, so they must have a physical and be immunized against tetanus diphtheria, as well as undergo the annual testing for TB or tuberculosis before you enter the preclinical and clinical areas. If you have a positive TB test or TST test, you will be required to show some evidence of a normal chest x-ray before you enter the clinical areas and preclinical areas. You are all required to provide documentation of starting the hepatitis B vaccination series before you enter lab. If a student is medically at risk for this vaccination, you will have to file or sign a decline form or a declination form. Students are also encouraged to undergo a titer test after you complete the hepatitis B vaccine series. And this test is used to check for the presence of antibodies, and it's usually performed 3 months after the completion of the 3rd injection. If the results show that the titer is low, then a booster will be highly recommended. Students are required to be immunized against or have documented immunity to vaccine preventable diseases like the mumps, the measles, rubella, and varicella in order to minimize the risk to patients and personnel. If the documentation is unavailable, then we're going to have to ask for serum titer levels to be drawn. If the titer results do not indicate any immunity, then the injections will be required. Students are required to have an annual flu shot as well. Documentation of all these immunizations and the physical form all must be uploaded to a website called www.castlebranch.com, and all the documentation is kept on file in a secure location to ensure that the confidentiality of the student is maintained. You can read all this information on page 7 of your handbook. Please know there's also a statement of immunizations that all students must fill out, sign, and return to the program prior to entering and starting the fall semester. NVCC recognizes the individual rights to self-determination and decision-making for all individuals with regard to public health vaccination recommendations. It strongly supports immunizations to protect the public from highly communicable and deadly diseases like measles, mumps, diphtheria, pertussis, the flu, and coronavirus for its students and employees. Effective protection of the public health mandates that all individuals receive immunizations against vaccine preventable diseases according to the best and most current evidence outlined by the CDC and the Advisory Committee on Immunization Practices. While NOVA does not require that all health professional students are vaccinated in order to be admitted into a restricted admissions health program, do know that vaccinations may be required by our clinical facility affiliates in order for our students to enter and participate at these facilities. So therefore, although it's not required to get, for example, the COVID-19 vaccine to enter the dental assisting program, in order to send students to do their clinical rotations out during the spring semester and the summer session, the clinical affiliates or the dental practices we send you to may require it. And if they require it, then you will have to get the vaccine. Therefore, we tell our students that it could jeopardize your attendance in the program. So this statement, you can feel free to review on page 7 and page 8 with further detail. Please know that the dental assisting program requires criminal background check and drug screening. And of course, all the results are uploaded to Castle Branch as well. Reasonable suspicion is defined as, but not limited to, the following behaviors, which is observation of drug use, abnormal conduct, evidence of tampering with the drug test, evidence of involvement in the use, possession, sale, solicitation, or transfer of drugs, and odor of alcohol. If there is a suspicion, students will be required to submit a drug screen while they're enrolled in the dental assisting program. Liability insurance is required to be purchased by all students, and that can be obtained from the American Dental Assistants Association at www.dentalassistant.org. Please know that there are environmental risks. So there are safety policies, procedures, and protocols are taught and followed according to OSHA regulations and CDC standards to provide a safe learning and patient care environment. Please review the environmental risk policy here on page 9 of the handbook. Another thing that is required for all students, faculty, and staff is to have their current certification in basic life support for healthcare provider to include cardiopulmonary resuscitation with an automated external defibrillator, otherwise known as an AED, for adults, infants, and children while participating in patient care activities. This certification is required, and it must be uploaded to the website called www.castlebranch.com, which it is kept in a safe, confidential site. Expired certifications must be renewed immediately. Program email policy, please, when you email each other or when you email faculty, please know that it must be done in a professional correspondence as such, so that it contains a proper salutation, complete sentences, correct spelling and grammar, and a proper signature. Faculty will make every attempt to answer the emails or correspondence within 2 business days of receipt. On page 10, you'll see that there is a dress code policy. In the dress code policy, the dress attire consists of students that they are allowed to wear casual dress attire during classroom sessions. Students are not permitted to wear attire that takes away from that professional appearance. We do want to maintain that professionalism and even as students when you're in the lecture hall as well. With the uniform, students are required to wear the dental assisting program's uniform during clinical and lab sessions. Uniforms have to be clean, pressed, and have an appropriate fit. As for the laboratory jackets, students are required to wear a black laboratory jacket in clinical areas, and the black jacket is to be worn during all patient clinical laboratory sessions and on clinical rotations. The shoes must be closed-toe and heeled shoes in the dental assisting clinic. Black shoes are totally permissible. Black socks or hose are to be worn with uniform shoes. They should be above the ankle with no skin exposed. Students are required to wear plain black leather Oxford shoes that tie or can be slipped on during all clinical and laboratory sessions. Shoes must be made of a material that can be cleaned and polished. They are not to have any colored or excessive woven designs. As for the name tags, You are all required to wear the dental assisting program's name tag on your uniform jacket. It is to be placed on the left side, and name tags can be ordered from the bookstore. Radiology badges. Students are required to wear your radiology badge in a visible location at all times during lab sessions and clinic sessions. Mute. All work that is missed must be made up, and the student will be charged with an absenteeism if the student is dismissed and they do not have their radiology badge. With hairstyles, students are required to have their hair pinned up off their neck and neatly secured away from their face. Ponytails or braids are to be secured. Hairstyles should have a professional appearance. Hairpins, holders should be as close to the hair color as possible. Hair color and the style should project a professional image. Please avoid unnatural colors such as blue, green, purple. We're trying to avoid those type of colors. We want to maintain a professional look. We are not looking for messy buns. We do want a neat bun if that is what is needed. When it comes to makeup, it should be in moderation and it should be kept at a bare minimum, okay, to enhance that professional image. When it comes to nails, students are required to keep their nails clean, smooth, and below the fingertip length. No nail polish is allowed, and nor is acrylic are not allowed either. This includes any nail polishes that where companies claim that they're porous and the water can go through. So we cannot have any gel nails or anything of the sort. So students are required to practice that, with the exception of staff and faculty. Jewelry are not permitted to be students cannot wear the jewelry except a watch and earrings. Earrings have to be worn in a traditional manner. One earring per ear is to be worn in the center of the earlobe. The size of the earring must be no larger than one's earlobe, such as 6 millimeters, for example. Students are not permitted to wear hoops or dangling earrings. One small stud in the ala of the nostril is allowed. The only rings allowed are plain wedding bands without any stone, and they're worn on the ring finger. We want to prevent any harboring of any bacteria in that area. Tattoos may not distract from the professional image. Some tattoos may require covering. Protective eyewear. So students are required to wear protective eyewear during their clinical and lab sessions. They are not permitted to practice skills or observe in these areas without such protection. This is an OSHA regulation and it will be enforced. The eyewear has to be anti-fog, shatterproof, and large enough to protect your eyes. If you wear regular glasses, you have to have side shields in the regular glasses. However, do know that when it comes to those glasses, you can actually feel air going under the glasses. So that's why I do recommend that you buy some oversized goggles that go over your prescription glasses so that you can have full protection, or else you're going to get some aerosol in that area. Okay. Let me see. Masks and gloves. Students are required to wear masks and gloves while you're performing procedures or when you're practicing skills in the clinical session, the pre-clinic session, and the lab session. This, of course, is an OSHA regulation and will be enforced. You are expected to practice proper personal and oral hygiene at all times. And just overall, a black lab jacket is to be worn when entering the clinic area. So the dress code applies to students during clinical, laboratory, and rotational sessions. And as you can see on page 13 of your policy handbook, there is a statement on immunizations that we reiterated earlier in this session, whereby all students must print their name, sign, and date, and return it to the program prior to entering the fall semester. This is a requirement. Okay, thank you very much. And this concludes our section 1 of the handbook for the dental assisting program.